All right, we're live again. Hello, Facebook world. Sorry for the glitches originally. Good afternoon. It's Melanoma Monday, which is always the first Monday in May. This is a day that's set aside to raise awareness about skin cancer, and particularly the most deadly form of skin cancer called melanoma. I'm Dr. Robin Travers, a dermatologist at Skincare Physicians in Boston. I am also on the medical advisory board of Impact Melanoma, which is our nation's largest melanoma-related nonprofit organization. I serve a few other roles at Impact Melanoma, not only running for and coaching our Boston Marathon team every year, but also working on a variety of educational programs related to this disease. Now, melanoma is one of the most deadly forms of skin cancer, but if it's recognized and treated early, it's almost always curable. So that's one of our biggest missions at Impact Melanoma. How can we catch melanomas early when they are thin and easily removed? So who's at risk for melanoma? The truth is that everyone is at some risk, but some people are at greater risk than others. People who have a family history of melanoma are at risk. People with a history of blistering sunburns in their youth are at risk. People who have used tanning beds and tanning booths are at greater risk. And finally, people with fair hair and light skin are also at greater risk. But even having lots of melanin pigment in your skin is not necessarily protective, so you can't count on that. Even people with deeply pigmented skin can develop melanoma. So if you're in any of these risk groups, and the truth is that almost all of us are in these risk groups, you can protect yourself by practicing safe sun habits, remembering to examine yourself from head to toe and watching for the warning signs and getting a yearly skin exam from your dermatologist. Now, we at Impact Melanoma had planned on making a Guinness Book of World Record attempt 2 days ago. We were poised to perform the largest skin cancer screening ever done in the world. But COVID-19 foiled our plans for this year. And for you, even getting to your dermatologist for a skin cancer screening is difficult in the current setting. But that doesn't mean that you can't do your own socially distanced world record skin self-examination. And I'm here to give you all the information you need to go ahead and do your own skin cancer screening right here and right now. Now, before we go through the mechanics of how to do your own skin cancer screening, let's review what we're looking for on the skin. It has been said that melanomas write their message in the skin for all of us to see. So what does that mean? It means that very often melanomas show up on the skin early with some very characteristic findings. And if only we know enough to monitor our skin for these early changes, we can catch melanomas early. It just means taking that time to look at your skin once a month. So what are we looking for? We're looking for the so-called ABCDEs of melanoma. So A stands for asymmetry. So we're looking for moles where one half look really different from the other half. And you can see this mole here. If you were to cut it in half, whoops, I lost the image. If you were to cut that in half, one half would look markedly different from the other half. All right, so let's get back to those photos. So B stands for border irregularity. So what we're looking for those are moles where it has a really jagged, indistinct border. So it's not a nice smooth line. Like you couldn't take a pen and draw a nice smooth line around that mole. That would be pretty worrisome. C stands for color. And it's no one color of a mole that worries us. It's when you get a single mole that has multiple colors within it. So you can have a light brown mole, a light reddish brown mole, right next to a deep dark mole. As long as each individual mole is evenly pigmented throughout, that's okay. It's when you see a mole like this, where it's got red, it's got black, it's got gray, then we start to worry a little bit more. D stands for diameter, all right? So any mole that's bigger than about 6 millimeters in diameter is something to worry about. Now, I don't expect you to go around measuring all your moles with a ruler, but a good rule of thumb is that 6 millimeters is about the size of a pencil eraser. So any mole that's bigger than about the size of a pencil eraser, you want to bring to your dermatologist's attention. Now, finally, there's E for evolution. So if you have a mole that's been there for a long time, but then suddenly starts to change, like maybe it develops these two dark bumps within it, or maybe it just gets itchy or uncomfortable or bleeds spontaneously. Those are the changes of E for evolution that should draw your attention and should draw your dermatologist's attention. So now let's move on to actually how to do a skin self-exam. Now remember, this is a world record attempt, so we've got to do it right. Checking your skin is actually pretty simple. It just requires your eyes and a mirror, all right? It should really only take a few minutes, but it could save your life. So the best setup is a full-length mirror along with a hand mirror here as well to see some of the trickier areas. First of all, you want to make sure you're in a really well-lit area. Facing your mirror, and we're going to pretend you're the mirror, you want to check your face, your ears, your neck, the chest, and your abdomen. And then you can use your hand mirror to check behind your ears and the back of your neck. And then you want to check your scalp, and that may sound really tricky. It's not common, but we definitely can see skin cancer on the scalp, even in someone who has a full head of hair. Now, if any of you are having your partners cut your hair during this time when you can't get to your hairstylist, have them take a look at your scalp. Otherwise, you can just kind of part through your own hair, looking for changes in your moles. We actually at Impact Melanoma have an educational program that is available to hairstylists and beauty professionals across the country. It's called the Skinny on Skin. So many skin cancers occur on the head and neck in spots where it's really difficult for you to check. But you know who can check? Your hairstylist. So when you can get back to your hair salon or your barbershop, be sure to let your hairstylist know about this program. So next you want to lift your arms and you're going to check the underarms and the sides of your body. All right, and then you're going to check, hold your arms out in front of you. You're going to check the front of your arms. You're going to check the inside of your arms. Then you're going to check your hands. All right, you want to check the top of your hands and the palms of your hands and your fingers and even the beds of your fingernails. Be sure to take your nail polish off so it doesn't obscure any pigmentation that might be happening on your nails. You can then take a seat and you can check the front of your thighs and your shins. And for those of you who are looking for some quarantine exercise, you can count this as some flexibility training. You can lift your leg up, check your feet, check in between your toes, check the soles of your feet. This is where you really get a little bit of a workout, all right? Then you're going to stand up again. You're going to grab your hand mirror again. You're going to look at the back of your legs, first starting at the calves and then the thighs. And then you're even going to check your behind because you can have skin cancer where the sun don't shine. And then finally you use your hand mirror to take a look at your back. So some of my patients say, I don't really know what I'm looking at. And that's okay for the first few times. Once you get in the habit of really checking your skin monthly, you're going to be able to find even really subtle changes in your moles. So what do you do if you spot something suspicious on your skin? Let's say there's a mole on your back that's getting bigger and has a few colors in it. In some parts of the country, because of the COVID-19 crisis, it's still really difficult to come in for a routine check with your dermatologist. But many dermatologists are offering telemedicine consultation, which is a terrific way to have your suspicious mole evaluated. Give your doctor a call and check with them about the availability of such services. Many teledermatology consultations involve a video conference, kind of like what we're doing here on Facebook. But what we dermatologists know is that digital images like those that you take from your smartphone can give us dermatologists far more information than we can get from the low resolution video. So here are some tips for taking the very best images for your dermatologist to evaluate. The first thing take your photos in a really brightly lit area. Getting light on your image is critical for photo quality to communicate the information that your dermatologist needs. Secondly, you want to take a couple of different views of the area in question. You want to take a photo from far away that's sort of what we call the forest view, for example, of your whole arm. All right, then you want to take a photo up close so you can really have your dermatologist evaluate the detail in your lesion. And finally, you want to take your camera and try to take an image that's sort of at a 45-degree angle to the spot you're looking at. This last one is really helpful because that side lighting helps your dermatologist see how elevated the lesions are. Another tip is you want to make sure that you're not using your selfie camera. All right, the selfies are fun, but they're not going to be as high a resolution as the camera on the back of your phone. All right, you really want to send a nice clear image. Now, getting your camera to focus on your skin can be tricky. Sometimes you'll see it comes in and out of focus. If you're having difficulty, it can really help to take a dark black ballpoint pen and you draw an arrow to the image in question. Okay? And that dark color gives the camera something much better to focus on. All right? So it's really going to be able to focus on the mole. All right? And finally, you want to screen your photographs and only send your dermatologist the ones that are really clearly in focus. Blurry photographs are not useful for making diagnoses. All right? If it's not in focus, take another picture. All right, so good luck with your skin self-examinations today on Melanoma Monday. Now, before I open this up for questions, I wanted to ask you a trivia question. You know, I was once on the game show Jeopardy, and I love trivia questions. So the first person to answer this correctly will win an Impact Melanoma goodie bag. So here we go. Which of these celebrities has not had skin cancer? Is it Hugh Jackman, Bob Marley, Leonardo DiCaprio, or President Jimmy Carter? So the first person in the comments to answer correctly will win that goodie bag. And at the end of this session, or perhaps right now, we're going to also post a link to a form in the comments section for you to fill out for a chance for you to win a sunscreen dispenser in your community just for attending the session. So now we're going to open this up for some questions. So let's see. First question, what if I don't have a dermatologist? Can my primary care physician do a skin cancer check? Well, the truth is a lot of primary care doctors have training in doing skin cancer screenings, and so that would be fine. Some internists have not had a lot of screening in how to do skin cancer, have not had a lot of training to do that. And that is no statement on the quality of their care as an internist. It just, you know, it's not necessarily part of medical training. So check with your doctor, find out if that's something that they feel confident and skilled with, and in which case have them do that. And if you have any questions at all, you can then ask for a referral to see your dermatologist. Here's another question. Would a melanoma on your scalp be tender at some times and not at others? Well, sure. Melanoma can at times be completely asymptomatic. You wouldn't necessarily be aware that it's there. But sometimes they can become tender or itchy or bleed spontaneously without rhyme or reason. So anytime something is acting up on your skin, give your dermatologist a call. And I'll tell you, sometimes I have patients call me and are concerned, and it turns out that it's a completely benign growth. And then they kind of say, well, I'm really sorry, I didn't mean to waste your time. Let me tell you, it's never a waste of time. I love to be the bearer of good news, and so does your dermatologist. So if you have something that's changing, let them know, let them take a look. All right, another question. What is the worst thing you can do if you see a suspicious mole? The worst thing you can do is just ignore it. All right, the fact is that a lot of times if you notice something new or changing or acting funny on your skin, a lot of times it's going to be completely benign. give your dermatologist a call. Let them evaluate it. Let them, have a great day in giving you some good news. But also, it may give them the opportunity to catch a skin cancer early when it's curable. All right, so let's see. Um, at what age should we get a skin cancer check? Well, I think that for most people, as I alluded to in my talk, most people are at some risk for melanoma. It's a rare person who doesn't have one of those risk factors that I reviewed with you. So if you have one of those risk factors, I'm sorry, my cat just came in and is meowing in the background, so ignore her, please. Um, if you have one of those risks, someone should be looking at your skin from head to toe once a year, every year. And if that is someone like your primary care physician who is skilled with doing that, great. If not, call your dermatologist um, to get another skin cancer check. So let's see if we have any other questions. I see a lot of answers to my trivia question. All right. Someone asked another question. If I had a squamous cell skin cancer in the past, am I more likely to develop a melanoma in the future? And the answer is yes. Any form of a skin cancer, it's sort of a sign that you've accumulated enough sun exposure that is going to put you at greater risk. So anyone with any form of a skin cancer should be having a once-a-year skin check. Have another question here. I have a new raised growth on my face. Should I have it checked? Yeah. Anytime, same thing. Anytime there's something new, something changing, you should have it looked at. And again, I don't want you to be afraid. Go to your dermatologist, get it checked out. A lot of times you may find out that it's going to be fine, and that's great news. Any other questions that anyone has? We've answered them all. Well, listen, if you have any other questions at all, don't hesitate to put something in the comments. Even though we're going to go ahead and end this live video now. Check one last time. All right, wear your sunscreen. Go do your skin cancer screening. Good luck and have a great day.